Lumbar interbody fusion. So these are the keystone surgeries, I would say, these days, because a lot of the times patients come to us who are having very, very, very big facets with big osteophytes, and just the decompression may not do in them. When the patient is having instability, again, just the decompression is not going to suffice. Young patient with a narrow spinal canal, iatrogenically created instability, revision surgery, significant disc degeneration, facetal arthritis with back pain, and deformity. So these are all the patients in whom you are going to do the interbody fusion. Now, when we talk about the interbody fusion, whether this is an anterior or posterior depends on whether what you're doing in regards to the transverse process. If you're going anterior to the transverse process, that is a bony landmark for us. If you're going anterior to the spinous process, that becomes the anterior surgeries. And if you're coming posterior to the transverse process, that forms the posterior surgery. So my friends, remember, transverse process is a key bony landmark which will decide whether the surgery that you're doing is going to be called the anterior or the posterior surgery. So anterior to the spinous process, the different options are going to be ALIF, OLIF, and LLIF. That is the depending on which, if you're going bang on anteriorly, that is the ALIF. If you're going anterior to these psoas, that is OLIF. If you're going through these psoas, that is LLIF. LLIF is also called as XLIF. Posterior options that are posterior transverse process, they would include TLIF, TLIF, and MIS-TLIF. So most commonly the surgeries that are done today are MIS-TLIFs, I would say, and OLIFs.